Well, welcome, Dr. Brophy, Dr. Andrade, to our monthly meeting. Today is a Thursday, March the 4th, and I will turn the meeting over to our chairperson, Dr. Brophy.
All right, thank you, Dr. Massour. So I'd like to call the meeting of the Board of Health for March to order. First item on the agenda is minutes, approval of the minutes from the previous meeting in January. So, February. Do I have a motion to approve? Motion to approve?
So moved.
I'll second that. Any edits at all, Dr. Andre? Or
No edits.
No. Okay. Motion being put before us. All in favor?
Aye.
Aye. So the minutes pass. Next item on the agenda, what I'd like to do is actually move the last item on the agenda, the Chavan variety licensing for a request for their tobacco product license renewal to be brought up as the next item on the agenda. If that's okay with you, Dr. Andre and Dr. Mondesor.
It works, yep.
Yes.
Okay.
Yes,
So
okay.
Can we notify them to let them into the
allow
meeting,
them in
please?
now.
Okay. Hello, so this is Dr. Mary Brophy. I'm on the line here with Dr. Andre and Dr. Mondesor. For the folks from the Chavan Variety store, could you please introduce yourselves to us, please?
Mr. Nisrella, yes, and if you want to introduce yourself and the other members as well. You have on this board tonight, Dr. Brophy and Dr. Andrade and myself. We have one member who is not able to join us tonight.
Okay, thank you. Thank you, Dr. Mondesir. And first of all, I want to thank you and thank members of the board for allowing us to appear before you and make a presentation. I am Philip Nesrella. I have a law practice in Brockton, and I am representing Mr. Babu Patel. He is the general manager and member of the Chavan LLC, and also Mr. Vikas Patel, who is an employee of the long-standing employee of Chavan LLC.
Okay, thank you.
And you let me know when you'd like me to begin, and I'll give an overview of the purpose that I am here.
Okay, would like the other guests to also introduce themselves, Babu Patel and Vikas Patel.
Me, Babu Patel. I am on the screen right now.
Okay. Are you the one of the owners, or are you? How are you attending?
I am the owner of the store.
Okay, thank you.
Thank you.
My name is Vikas Patel, and I'm one of the employees at the Chavan Variety.
All right, thank you. Dr. Brophy, what's your pleasure? How would you like to proceed?
So I'd like Mr. Attorney Nesrella, if you'd like to present your case to us, please.
Yes, thank you. With that, let me state that Chavan LLC, Chavan Variety, is located at 520 Main Street in Brockton. Now, many of you may know that years ago, that was a long-standing, well-known variety store called Savis Variety. In fact, as a teenager, a young teenager, I think I used to go down there to get my Archie comic book. So I know it goes back a long ways. And for about 40 years, and 20 years ago, Mr. Patel had purchased the variety store and has been operating it since for the last 19 or 20 years. And it sells the similar sundry of items, from food items, dry goods, magazines, tobacco products, drinks, et cetera, et cetera. And it services all of that south end of Brockton. It's always been the go-to place. And he has been operating it regularly and somewhat commendably, where he has not run into any issues, any violations. He is well respected, well loved by his clientele. Mr. Patel, Mr. Babu Patel, now lives in New York, and he has several reliable employees that have worked with him over the years. During the uprising of this unfortunate virus that we have all encountered, sometime back in last March, several of the employees got understandably nervous and concerned about the environment that they were working within. They had a lot of customers coming in unmasked, and at that time it wasn't as stringently implemented. And they had expressed their concern to Mr. Babu Patel that they were concerned of either catching COVID or something else happening to them. Mr. Patel had understood that one of the employees had become ill, and I don't know if he was told that. That was an understanding that he had received. So certainly when it was indicated by his employees, they weren't comfortable working there and they wanted to take a respite, they wanted to just temporarily step away from work, those were the people he entrusted with the business. So he had no alternative but say, okay, fine, you can close it until this thing turns around and we get back on our feet and we have the health situation we can be comfortable with. So during that time, the store was temporarily shuttered. And Mr. Patel had notified the postal service, the post office, that he wanted all of his mailings forwarded to his address in New York. And you will note from the attachments that I had attached to my brief, you'll see copies of all of those envelopes that went to New York. The only problem was not only the city of Brockton notifications, but from the utility companies and other addressees were sent in June, May, June, or July, and they never got to New York for some reason until November. Some of those notifications, or many of those for the city of Brockton, had included notification of the renewal license and the dates that had to be renewed. Those never got to Mr. Patel until November, and I believe August was the date of renewal. When Mr. Patel found out about it, I believe he first communicated with a member of the Board of Health, Ms. Badger, to discuss the renewal situation. She indicated to him it has already gone by, and he said, well, what does that mean? She says, well, it's gone by because you closed your store and we retired the license. Now, the point I would like to make is the store wasn't closed down, it was temporarily shuttered. A closure with any other term of law always means you leave without the intent of returning. He certainly intended to return. He continued paying all of the bills, utilities, and expenses within the store. He intended to return and put his people back to work. About the renewal date, he said, there were circumstances beyond our control, which have basically affected every individual and business person, where he wasn't cognizant of the date, he didn't receive the notification, and he didn't, like most people have it written down and read in his calendar, this is the date for renewal. So that date went by and he said to her, I'd like to renew now. And understandably for Ms. Badger, she says, I don't have the authority to make the renewal. So that brings us in front of the board. I certainly suggest this is a situation of not stringent technicality, but an understanding of the extenuating circumstances that has affected everyone, including especially Mr. Patel, that his having not hit the date for renewal was because he wasn't notified or did not receive the notification because of the Postal Service issues. Otherwise, he would have done that. And as I say, he had continued to pay all of his other bills that he was aware of. I clearly understand, and I know Dr. Brophy and Dr. Andre are well aware from discussions way back. I understand and I respect and I recognize the position the board has taken relative to tobacco. And I also don't disagree with, we talked about the effects of tobacco. This is not about the effects of tobacco. It's about treating a business person fairly, so he doesn't have the sense that this, well, I got you now type of thing. That's not what we're about in Brockton. If this is not a situation where we're bringing him in for a violation of some way in which he was functioning or malfunctioning his business. This is a situation that, because of the circumstances, everyone being home, businesses being shuttered, offices not even having a schedule because we're all out of our routine. This is a situation where this individual, I believe, needs and should get the relief from the city. This is a situation where even the courts, and I cited this in my memorandum to you, the courts have recognized that these dire conditions have to turn around and get some type of extraordinary relief. There are many businesses in the Boston area, I've represented a couple of them, that couldn't pay their rent, and they were protected by the courts because of what we call frustration of purpose. Everything you do was frustrated by this virus, and there had to be some accommodation given by one of the other parties involved, be it government or being a landlord, to the people who were affected. So it's parallel to the situation we're in now. And I will pretty much come to a conclusion of my presentation by stating that, oftentimes we come into situations, and this is one of those rare, unique times where we're between law and life. We rely on these unwritten rules called equity. Equity is basically how we treat a situation fairly with the unwritten rules that apply. Sometimes it's by common sense. Sometimes it would have been by Shakespeare's adage that the quality of mercy should not be strained, but we try to get to the right place for an individual. And in this case, this particular individual who's had that store for 20 years, the store that existed for 40, 50 years prior to him, could be terminated because this was a significant component of his store, and he struggled all of this time in trying to make the store what it is and keeping it on its feet for 20 years. I suggest to the city and respectfully request from the city that we need to help him and allow him to renew his licenses. With that having been presented, I would be more than pleased to respond to any questions the board members may have.
So the item's open for discussion. I guess one of the questions I'd ask is, has the store reopened?
Mr. Patel?
And then as soon as I have my license, I like to open the store right away.
He's afraid of having it open without products being able to be sold. He's got to renew the milk license, some of the food. So he doesn't want to open it and not have 100% of product available.
Has he started the process for the other licenses?
Yes.
And the store, the plan is to open the store. The current rules are that if the store is shut, the license will not transfer. So I think that's the city ordinance is the license will not be transferable. So so clearly having the store reopened is an issue. Are there plans to sell the store, or will you continue to be the owner of the store?
He's going to continue to be the owner of the store.
Okay.
So
I've
it wouldn't
advised him
change hands at all?
before. I have advised him exactly as to what you just said, Dr. Brophy, about the transferability, et cetera.
So there's no consideration of changing ownership?
Not that I'm aware of at this time, no. At some time in the future, who knows?
So when it closed, did it kind of remove all its products and shut down completely?
He removed all of his products. He was afraid of some type of theft.
Right.
That is a more of a crime district than other parts of the city. He was concerned there would be break-ins, and he saw what happened on Newbury Street in Boston, saw what happened throughout the country, he not only, in where he wasn't around the area to stand guard, he decided to take everything out that would be of value. And it's been warehoused and ready to go back in.
And when is the plan to reopen, Dr. Murphy, when is the plan to reopen?
The plan to be reopened is right after we get this gracious consent from you.
Right.
So is having the tobacco license the only contingency for reopening the store?
Yes, because I trust that, and I speculate that the other licenses should be as a matter of pro forma, and he wouldn't have any difficulty getting those.
Dr. Brophy, are we now allowed to discuss this in executive session?
I believe we are. Yes. I mean, the issue for us is I really want to see that the store is opened and functioning again, and that ownership is in place and the employees are back at work. And because if we give you back the license, then you can sell the building with the license. And that's not the intent of this, is to be able to transfer that license. So I think, that's the issue. I mean, the store being reopened, it doesn't seem to me, if your plan is to reopen the store and there are other permits and the store can reopen, and it is it's functioning, then it's clear to us that there is a plan to reopen and you will do it. And you are an open business. You're not for sale. You're going to continue to be the owner here in the city of Brockton. I think we could bring things under consideration, but the assurance for that is I think needs to be in place for us. This is at least my opinion. And Dr. Andre, do you have any thoughts? I think we can move into executive session to discuss this.
This is where the questions come arise. So the idea that in other municipalities that have similar regulations, that there would be, forgive me, and I mean no disrespect, gaming of the system, that we take you on your word that you're planning to reopen business under the same management and same ownership, and we allow for this to kind of move past the regular regulations, and then 2 months later you sell the business and believe that you can transfer the tobacco license to a new owner. The point is that we're looking to reduce the amount of retailers providing tobacco. If a store closes, we don't renew the tobacco license, and if this you just decide to sell this down the line, then that supersedes the intent of these regulations. And that's the concern. And so we're hearing you say that you mean to return back to business after 20 years of continuing, and that you mean to maintain ownership under the same management, and that your employees will return and everything resumes as if COVID never happened. Is that what you're telling us?
Mr. Patel should be the one to answer those questions where he is the owner, not his.
Yes, I have a plan. As soon as I have a license, I like to open early as possible to put some more merchandise and, whatever the necessary stuff. And then I like to hire my employees back, and we like to start business again with the same name.
And you understand that you couldn't transfer this license to another owner?
That's fine. Yeah. No, we're going to keep the same name.
Dr. Brophy, do you want to discuss this in executive session?
Yeah, I'd like to discuss it in executive session. I would. So do you want to make a motion?
Can the TV station allow our visitors to go into a waiting room and us have this executive session?
I think I can do that. Oh no, let's see.
Is that your intent, Dr. Brophy, for us to for those?
Yeah, I think we have to vote. I think we have to vote on that, Dr. Andre.
Okay.
So,
okay, we're back into regular session.
So we'll, yes, restart regular session. And Attorney Nasrallah and Mr. Patel and Mr. Patel, are you back online?
Yeah.
Okay, great. Wonderful. So we went into executive session, it's sort of reviewing the situation. I think the concern from us is assurance that the business is reopening, that the owner will remain in place, that the employees will be rehired, and the intent of our law as written is that the licenses are not transferred to new businesses. And if the business, what we have to go back to our lawyers to review is, what determines that it's a new business. I'm not sure if keeping the name of the business and reviewing what our law says or what our documents say about this. We'd like to review with our law offices here and attorneys here in the city. We don't want to give the license, and the intent is not to hand it on if it is a new business, and we don't want to see that happen. But also, I think we're very sympathetic to the fact that if this owner is opening his business, that you're rehiring the employees that have been there, that you plan to keep this business up and running within the city, that we are sympathetic to the issues that have happened, and returning the license. I'm not sure if there's a contingency, and this is what we will be discussing with our lawyers, that you reopen the business, you redo all your other permits, you have your employees rehired, you are functioning as a business, and then we can consider. And these are the situations that we'd like to discuss with the city attorneys. So for now, I think our decision is going to be put on hold until we can discuss things with our legal office. Any questions on your part?
Well,
Mayor,
Dr.
can I just
Brophy.
ask, recognizing that I know time is of the essence for
Right.
the Patels. Dr. Maser, do we know how quickly we can contact our lawyer and get some reading on all this, and can give our guests a kind of timetable that allows for us to understand that?
I know they have they're doing some transitions and they're bringing in some new staff members. So I cannot conclude that the length of time that they would require, but I would say 2 weeks. I will contact them and then get back to you, inform you, maybe informally, but at least I'll do that immediately, and perhaps they may request some time to revisit that. So as soon as I contact our solicitor, the office of our solicitor, then I'll get back to you.
Can you just let them know the urgency of this, that
Right.
is any way that they can expedite this to respect the concerns of the Patels of being able to get up and running as soon as possible? We greatly appreciate that.
Certainly.
Dr. Brophy,
Yes.
I just wanted to add something that was mentioned to me by Mr. Patel during the break. I wasn't aware he did receive all of his other licenses and permits.
Okay.
Including the cigarette also.
No, you filed for it, but you received your tobacco, your milk and the food and all that. Is that correct?
Yeah.
Okay.
And again, we'll be reviewing this with the lawyers as to whether or not just giving again, we want reassurance that this owner is reopening his current existing business before giving the license back. Again, if we give the license and the business doesn't open and it's sold, and our regs are applied that say that there's a transfer, and what we have to figure out is with our lawyers what if continuation of the name and how the rules are written that allows for a transfer to take place. And I think it would be against what the intent of the law is to decrease the number of tobacco institutions that get or stores that can supply tobacco in the city, as we're far above many other localities. in that, and there is an intent to try to decrease the number of places that sell tobacco within the city. So, and again, the contingencies of whether or not a contingency of opening the business and rehiring and having the store open is allowed. But so we'll review that with our lawyers. So,
I understand
and hopefully
that,
very quickly get back to you.
yeah, I understand they're an extremely well-trained group of lawyers. You think we could do it within a week?
Well, we were asking them to expedite that, and I also would ask Dr. Brophy, is there a way to do that without waiting for next month's meeting? Can we just convene briefly when we get to find all the information we need to Dr. Montessor, and we could have that brief call and then have that happen?
Yes. Yeah,
outside
we
of
just have to
session?
announce, we just have to put there's a time period where we have to make an announcement that we are having a meeting, so that the public is available, or can be recorded, et cetera. And it's an open meeting. For open meeting laws, we do have to announce it. But certainly as soon as we got that, we could call the meeting and make our decision at that point.
Zoom allows us to do that in a timely way. So I hope you hear in all of this that we understand the urgency on your part and want to do it as expeditiously as possible. And certain things are out of our control. Hopefully the solicitor can appreciate that as well. And this shouldn't be a hard decision to make. It's just getting their expertise employed as quickly as possible.
We appreciate that.
Cool.
Okay.
Thank you.
Okay, any other discussion or any other questions? So we will push hard to get this expedited for you. Once we have the information that we need to make a decision, we will call a meeting, we will notify you, and we will be, as soon as we have that and can make the public announcement of the meeting, we'll have that meeting for you, okay?
Thank you.
Thank
All
you
right.
very much to opportunity to open my business. I really appreciate. Thank you.
Well, we appreciate
All
you,
right.
and I hope you all stay safe and healthy.
Thank you.
Okay.
Same to you.
Thank you.
All right.
All right.
Take care.
Well, we'll be in
Bye-bye.
touch.
Thank you.
Doc.
All right. So let's move to the next item on the agenda, which is the update on the city's COVID situation. Dr. Montessor.
Yes. Thank you, Dr. Brophy. And
So I think the vaccinations were first. So
yes. Okay. Presently, we have a clinic going on. I guess it's just closed. This is the third clinic for this week, but we held our first clinic on January the 11th, when we covered the first responders, and that covers the police, the fire, and the advanced EMT, advanced EMS. So from that point on, we have been vaccinating, and the total number of vaccines, I think I mentioned that in the agenda, but just to highlight it, we have received 3,064 doses of vaccines from DPH, 2,670 Moderna, and 394 the Pfizer. The Pfizer is about to get the second dose next week. So total, we have received 900 second dose up to last Friday. So basically, this statistic that I'm giving you now covers the period from January 4th to February 26th. So the total that I gave you.
okay.
This morning, yesterday we have received an additional 500 of the Moderna. So that is not included in the data that I'm giving you now. So basically, we've covered all phase 1 individuals who wanted to get a vaccine, and we had a vaccine for, and also phase 2 individuals 75 plus. And then when the 60 plus were 60 pluses were eligible, including other individuals with 2 plus comorbidities, we have also covered some of those. So the total is 2,754 that we have administered so far. It has been difficult to get more, but so far we've been receiving a ration weekly, sometime 100 doses, sometime 200. Last week and this week we've received between 400 and 500 doses for those weeks. So far that's where we are, and I'll answer any question on that part.
And you're now using the Shaw Center. Is that where the public health? Because you had been
Yes,
using the high school. Yeah.
We transitioned as of February 19. We transitioned. We left the school. We had our last vaccination clinic at the high school, and then as of last week, we have transitioned to the Shaw Center, which we are using with the Brockton Neighborhood Health Center. So this week they started vaccinating there. They closed their testing site because they were also doing testing there. So as of Monday, they have closed testing and they opened the whole the hall altogether for vaccination. And yesterday we had our clinic with them. And the National Guard has been assigned by the federal government also for them, but we also benefited, Board of Health has also benefited, or the city at large has benefited from the National Guard, because basically they vaccinate and then we do all the other ancillary activities, registration, drawing. Observation is done by Brewster Ambulance for us, or for both operations.
Great. And also setting up the second appointments for follow-up doses. So
yes.
Yeah. And does the community health clinic up there, do they get a supply as well, or is it just the city supply?
Sorry. Yeah, they received their supply. I think moving forward, they will receive, well, they're supposed to receive more supply. For this week, they were supposed to receive 2,500 doses. And then as a function of time, they should receive a lot more. I don't know exactly where they are for next week, but so far, that's the promise from the feds and the state.
Great. And how are people notified of do they schedule appointments to come into the clinic, and then is it on the state website? Is that how the appointments are made, or is there another mechanism?
At one point, it was on the state website, mass.gov. However, it's not a Massachusetts open clinic for everyone. So basically, the priority is given to Brockton residents. And so it was removed. And then they have structured, Brockton Neighborhood Health Center has restructured and advertised. And then the city site is also allowing people to register, to pre-register. And then from that list, we call people as the clinics are structured or scheduled.
Great. And is any of the health centers, like any of the hospitals in the area, receiving vaccinations as well?
Are you
aware?
They have been put on hold. I probably, at least for 3 weeks, they have been on hold, but I think they have been reconsidered. I don't know exactly when they will reopen. They will give them more vaccines, but they've been under consideration by the state again to receive more vaccines, but so far not yet.
Okay, great. All right. Good. So probably now with the increased supply with Johnson and Johnson vaccine coming online, hopefully there'll be more vaccines coming and more widely distributed in the city. So, okay. Dr. Andre, any questions?
No, I appreciate the update.
Thank you. Okay. Thank you, Dr. Matsuoi. So then the dashboard in the city, current statistics for the pandemic in the city. Have we seen any drop in the percent positivity rate?
Yes. Let me pull out the latest here. Most likely, we will have a drop in the city numbers as of next week in the statistics. So, which means that we will go back to yellow
Right.
sometime next week, even though the numbers are still high in relation to what they were before, but they will be about below 4% in the population that test positive for 100,000 individuals. So, strike that. No, 4%. It will, once it drop below 4%, so that would be one of the criteria to transition from red to yellow. And so by next report, which should be next week, we're anticipating getting back to yellow.
That's great news because you know we were in double-digit positivity rate there for a while. I think in the 10% range at times during the peak of the pandemic. So that's wonderful news. So, and hopefully with the vaccinations and people continuing to follow the guidelines, staying masked, that it will continue to see that decline. So that's wonderful news. Okay. And then finally, the health promotion and public health education partnerships throughout the city. So any updates?
Yeah. With that, we have a couple of ambassadors, but we have lost the school nurses because of school reopening.
Yeah.
And so therefore, they're helping at the clinic to help make the calls for people to come to get vaccination and then help with the clinic. And one of them is supposed to start early next week. This week, she had a minor surgery. She could not start, and we have a few more people to interview. One additional person that we have interviewed and is ready to come on as well. So basically, by next week, we should have up to 4 ambassadors. So we're looking at to see how to move them from what they're doing now to what they were intended to do in the first place. But because of the manpower, we using their the skills in the vaccination clinic. But we're also looking to see if we could move, if we could leave Brockton neighborhood at the Shaw Center to continue vaccinating, because the intention is for the Board of Health to do second doses for all those that we have, for all individuals we have vaccinated, and then phase out from the Shaw Center, but increase our presence in the community with high rise, low rise, and like churches to see if we could set up clinics there to help people get vaccination, and while we do education about vaccines as well.
That's great to hear. And also, you know, do you know if you're going to be getting the Johnson & Johnson? Because actually the logistics of being able to go out to the community is much easier with the Johnson & Johnson vaccine than it is with the Pfizer or Moderna, particularly the Pfizer one, where there's such tight controls over the amount of time that the vaccine is viable at red room temperature. So,
correct.
Yeah. So,
it is a big question mark because it's left to the state to decide Well, I guess it starts from federal government down to the state, what's available
Right.
and what we will municipalities will receive. I should also mention that a good news for the city of Brockton, we have been selected among 20 municipalities in the state to receive additional doses of vaccines for the residents of those cities and towns. So I think it's a good news, and we also have a liaison at the state level to consider the issues and vaccine requests, and then work with us to make vaccines available as more supply comes to the state.
Great. And do you? I'm sort of concerned about sort of in our communities here in the city. Any reluctance that you're seeing in any of the groups within the city for vaccinations? You know, because these health promoters is really this is an issue, overcoming that fear of getting the vaccine, and whether you're seeing the full representation of the city of Brockton population and other areas we should be targeting some of our health promotion campaigns to get folks to come in and get their vaccinations done.
Well, there's a small snapshot study done at the Brockton neighborhood with vaccination among the staff and some of the patients. So basically it shows a trend, but as I said, it's a kind of a snapshot where they look at the staff and patients. They find that among the four main populations, there is one group that received 13% of that received the vaccines, 27% in another one, and then there's another group that is interested in taking vaccine up to 90%. So there is a big gap there when we look at it, and so therefore that's an eye opener, I think, for the rest of us to see how to address different ethnicities in terms of taking the vaccine. So I think that's where the Board of Health can work to see how we can really make a difference in getting people to understand the necessity to get vaccinated.
Yeah, it clearly is an issue. I think approaching the churches, getting ambassadors. This is why the health promoters and ambassadors is really important to get people from the populations that are reluctant to come forward and be the ambassadors and for those populations, because it really does make a difference to see that members of their community are being vaccinated. And I think there's just a lot of reluctance out there, and also concern about vaccination type and how rapid these vaccines came online. Being able to explain to people the risk of COVID as well, and it's very concerning that some of the highest risk populations have reluctance to receive the vaccine. I really think that we as a Board of Health and should be really trying, if there is some disparity in coming forth with the vaccines, really trying to find those ambassadors in those communities to step forward and help us to reach that community.
There's also some recurring themes across the state and the country that even when there is interest and enthusiasm about getting the vaccine, there is a subset of our marginalized populations and communities that don't have the means to travel even across the city, other than to walk directly. And in the winter, that's a different challenge. There have been some communities, even in Massachusetts, that have had home health aides, home health nurses, and others deliver them to certain people that just don't have that transportation access. And I don't know whether that's an issue that has come to light in Brockton, but again, it's something that other communities have, and if we've seen it in other communities, it's quite likely to be present here. I actually was just part of, I'm on the Massachusetts Public Health Association, and they're doing a petition to try to get the governor to make sure that he holds some of the promises, including giving some infrastructure and other resources that acknowledge that what I just said, that there are some community members that just don't have the means to get to the locations, no matter how accessible they may be to the general population, and a whole bunch of other things that have been kind of undermined and neglected in the midst of those that have English as a second language and other kinds of things that just have made it harder for those that aren't easily able to make their appointment, get in line, stay in line, or get online if necessary to make this possible. And there's why you see some of the disparities as well.
Yeah. That's why, using the things like the churches or the high rises, the more you can bring the vaccinations to the community, the better off we are. So being able to do these outreaches and going out at various communities, because that community will know who has difficulty getting there, maybe can support each other in getting individuals to the vaccination center. So it really is important to be able to, and I'm glad to hear that the plans are to start moving out and giving vaccinations at locations around the city. And we should be sure to target areas where we know people. Strategically put it not just in certain areas, but to really reach out into all parts of the city to make sure that folks can get there. So
exactly, yeah.
Yes, we're working, and basically we are a little bit short of hand. So next week we are doing second doses at the Shaw Center almost the whole week, Monday through Friday. So the mayor was looking to see if we could start low rise next week. But 3 nurses and myself. So basically, at the health department, we have sanitary inspectors. We have an animal inspector. We have administrative assistant, but real or core public health individuals is 3 nurses and myself. So I had to tell the mayor, well, we are limited. We cannot spread that thin. And we don't have the school nurses we have now. So I think Booster will start doing some work to the to this population probably within the next week or so. And then once next week.
Well, I was just going to ask, do you know of any programs that allow folks that are other folks that can vaccinate? I know you have the National Guard involved, or Brewster Ambulance, or other ways that, because I know there are a lot of folks that are volunteering for vaccinations. I just don't know if there's ones that a group of vaccinators that volunteer, or programs that allow people that are volunteering to help with vaccination programs to come and assist the city. Craig, do you know of anything in the state?
The whole state has a what do they call it? We spoke about it at the last meeting that I was at Brockton. It was the something corps, is it the emergency corps or the retired corps, or of retired nurses, doctors, and others that are online. I'm still licensed, and I'm on the register to be called if needed. I can't remember the name of the corps. Do you know what I'm talking about, Mary?
Yeah, I've heard of it. That's what I was asking you. I cannot remember the name of it, but the issue is whether the city, if they plan a vaccination center at one of the high rises, is there someplace we can look into this, someplace to contact to see if we can bring in extra people who are certified as vaccinators.
Yeah, I think
to
it's a
come in
reserve
and-
corps is what it's called.
I think, yeah. I think it's
Medical
some
Reserve Corps?
Medical Reserve
Medical
Corps.
Reserve Corps or something, that we may be able to get some help so that when you plan a vaccination at a place like the high rise, that you could get a few more vaccinators in beyond the 3 nurses and yourself to help with the program. It certainly goes smoother and you know, it depends on how you operate as well. I mean, some groups, you know, even pharmacists, I mean, the pharmacists are often drawing up the vaccinations, and vaccinators are vaccinating, they're not doing the draw and the vaccination. So, there are logistically ways that you can speed up the way you're doing your vaccinations without, if you're limited by the number of vaccinators. But it does require the infrastructure support around it to do it.
Yes, and one of the things is the ability to have at least some form of transportation on site, ambulance, in case
Right.
that doing
Right.
observation, there is a
Right,
case to
right.
be transported to hospital. Now, for the vaccines that we have administered, we have not reported any major incidents, but we want to make sure that if it ever happens, that we have the resources
Yes,
to be able to do
yeah.
that.
Yes, you do have to have those resources available, at least for Moderna and Pfizer. I believe it's a shorter observation period for the Johnson & Johnson and less of an issue with those type of reactions.
Mhm. Yes.
So, yeah, I believe it's Medical Reserve Corps, but we can assist you in looking, trying to find out about that. Okay.
Thank you. Thank you.
Okay. All right. Any other issues?
Let's see. There is one miscellaneous that I'd like to bring to your review. There is an organization, an assisted living in the city, that is looking to have a standing order to be able to do testing. Now, it's interesting that they contacted the Secretary of Executive Office in the state, who recommended that they reach out to the Board of Health. Now, they asking the Board of Health to provide them a standing order to be able to do testing. I told them we do not do that because the Board of Health, we only have one medical person on the board that does the standing orders, but they're still pushing. And then they sent me today 17-page document. I guess they downloaded from the Executive Office of Elder Affairs. So I need to look at it and see what it says, because it seems that they of the opinion that the Board of Health can move to sanction their ability to be able to do testing.
Yeah, well, testing is a different, because the testing, whoever is responsible for conducting the test is responsible for the follow-up and et cetera. In doing that, and I think that's why, you know, testing is a whole different game. What tests, how it's to be used, who's doing the testing. There's so many quality steps in it, and also it requires the appropriate follow-up type of procedures as well. So that you know, screening testing is an issue. So look through the documents and see. But it, you know, you were right. The Board of Health with limited resources would be, you know, that a standing order. If it comes from us, we're responsible for all of that work that needs to be done. So and you can't not be able to follow up in the testing and appropriately identify and do the contact tracing, et cetera, that needs to be done on top of doing the vaccinations as well. So.
Okay.
Does the community health clinics aren't they doing the testing in the community? I mean, this has been really where the testing has been done. And then the state did do some testing at Massasoit for a while. Is that correct?
They stopped, I think, around beginning of February. They stopped and they started over again. Yeah, so they're still testing.
Yeah, it depends on what the testing is, and you know, some places like school, I mean, people are screening, and so it's testing for symptoms, it's testing for screening, it's testing for contact tracing. There's different reasons that testing is done. So and different rules around how they should be, which test should be done, and how it should be followed. So the devil's in the details there. So.
Okay.
Okay, so you can review the documents and get back to us on that.
Okay. You want me to touch base with you once I review
Yeah,
it, or you
you
want me to forward it to you as well? Because they send it electronically.
Yeah, you can forward it to us. Yep.
Okay.
Great. All right. Any other items?
Basically, I think we all set. Next board meeting will be on March the 4th.
April 1st. Right.
Oh, yeah,
Don't
right.
go backwards, Dr.
I'm sorry.
I want to move forward.
Yes.
Let me tell you, every day and every month looks the same so far. So it's nice to see a little extra sunshine in the morning and evening as the days are getting longer, because it's been a long year. So, all right. So the next board meeting will be on April 1st.
Yes.
And we may need to call a emergency session based upon the review from our legal department on the licensing issue, tobacco licensing issue. So with that, a motion to adjourn the meeting.
Motion made.
All right. All in favor is aye.
Aye.
And I thank everyone for attending, and thank you again, Dr. Montessor, for all the information. And please send us the documents, and we'll be in touch about the ruling from the legal department. Okay.
Yes. Thank you.
Thank you,
Thank
Dr.
you.
Montessor.
Wonderful.
Thank you.
Okay.
Thank you so much.
Brophy.
All right. Take care. Take care, everybody.
You too. Take care. Bye-bye.
Bye-bye.